Hey guys, this is Dr. Hub. Today we'll look at the normal distribution. So in normal distribution, it is a curve. So this normal distribution curve, it is the most common shape taken by continuous data. So it's the most common shape taken by the continuous data distributions. It is also called the bell curve. It is aka the bell curve, and because it is bell shaped, so it is also known as a Gaussian distribution, after the mathematician the Carl Friedrich. So after the Carl Friedrich Gauss, so it's named after it. The following is the image. So let's draw a rough image. So that's how a graph looks. So let's look at some standard features of a standard normal distribution. So it is defined by two parameters, that is a mean and the standard deviation. So there is a mean and the standard deviation. Next is there is a mean of 0. There is a mean and this is of 0, and the standard deviation is equal to 1. Then the mean is equal to median is equal to mode. The symmetry and the asymmetric can have a bell-shaped curve with a single peak. The symmetric and have a bell shape and have a single peak. The total area around the curve is total area under curve. If you see, it is going to be 1. Now the frequency of value is more around the center. The frequency is more in the center and less. It is less around the tails. So there is no skew in the curve. There is no skew in the curve, and data such as, so examples, the data such as BP, height, or the IQ score, they form a normal distribution. So what is the empirical rule of the normal distribution? So we are going to look at the empirical rule. So approximately 68% of the distribution falls in the first standard deviation. The first standard deviation is going to be 68% the distribution. So it means that the mean plus or minus SD. Next is approximately 95%. 95% falls in the second deviation, the 2 standard deviation. This is the mean plus or minus SD, 2 SD. Then comes in 99.7%, the distribution falls within 3 standard deviation. This is basically the mean plus or minus 3 standard deviations.